is Janae Gerard, and I'm here with Michelle Robin, and she's the author of Wellness on a Shoestring. Thank you so much for being with us. I really appreciate it.
Well, thank you for having me back.
Well, many of the questions that have come out from you guys online, especially, revolve around sleep, revolve around relaxation, anxiety. So I thought we'd ask Michelle today, especially some of the things that are in her book, which I highly recommend. I just finished it, which I love. First off, I wanted to ask you, in the book that you mentioned mindfulness, and I was hoping that you could explain a little bit about what it is to be mindful, and then also how that might help our group move forward after treatment with their relaxation and reducing anxiety.
I think being mindful, what you want to do is, I think we get an automatic pilot with our life, and we say yes when we really mean no, and we say no when we really mean yes. So being mindful is really checking in from a holistic standpoint with what is your spirit willing to do, instead of just saying yes. And so it can be mindful about when you're eating. Are you watching TV when you're eating? Are you on the phone or on your computer while you're eating? Or do you just sit at the dinner table with your family and actually engage in a conversation and be mindful of, gosh, let me chew this food. Oh, let me smell this food. Let me actually taste this food instead of inhale this food. So being mindful crosses over many aspects of your life. And I think that a lot of people get caught up in the doing mode instead of the being mode. And I just encourage everybody to take a few moments and plan their day in their mind, and then at the end of the day, kind of see if it went how they expected. And maybe not for the last minute details, but just being intentional. Mindfulness is being intentional.
Mm-hmm. You know, I've noticed that if you practice, sometimes it sneaks up on me where I'm not doing it, where I'm consciously trying, but something slips into my mind. So I notice if you can practice it too, it starts to come a little more easy.
Well, it's kind of like meditation. People say, gosh, I just can't sit in the silence. And I think it's just as you're doing some meditation or trying to be in a still spot, as your mind wanders, like everybody's does, is then you say, what is a word? So like one of the words that I'll use is peace. And so when my mind starts to go to my to-do list or thinking about that, I'll go back to the word peace. And I may stay there for 20 seconds, and I can start to wonder again. I go back to the word peace. And so just keep going back to a word that helps bring you back to your center. Gotcha. And just an awareness.
Gotcha. Well, another question that my group always talks about is sleep. You know, many of us are forced into premature menopause because of chemotherapy, radiation, some of the treatments that we're on. So what's the importance of sleep, and what would you say to our group about ways to try to get a grip on being able to sleep peacefully and really taking control of that?
Well, once again, go into it with being mindfully. So one of my favorite sleep routines is to make sure I close the day out. And when I close the day up, I also clean my body off. Because not only with people who have are dealing with cancer or cancer recovery or thriving after cancer, it's also about the average person who's losing sleep. Because we are thinking, once again, we're in that doing mode. So we go to sleep, and if our body chemistry is not keeping us up, our mind is. So and people all day long are coming in, and I see people come in and they kind of, in a sense, people are asking a lot of us, and I'm kind of throwing up all of us. Here's my issue. And if we're high functioning people, they want us to fix it. And sometimes we are left with that issue hanging on to us energetically. So I love to end my day with either a hot shower or a hot bath, because water brings energy. And so I get reconnected back to myself, and not whether it's my kids or my significant other or my patients. I just get back to my thoughts. And then to think about, do you have a bed you love? You want to love your sheets. You want to love your bedroom. And you want to, we'll talk in a little while about clear your space. You want to also make sure you have a free space. So first of all, it's setting the intention and the mindfulness of preparing yourself for good sleep. And it's also, I find that some of my patients will wake up in the middle of the night. Part of it could be a blood sugar issue, because people are trying to lose weight, so they may have their last meal at 5 or 6 o'clock, and they're waking up about 8 hours later at that 2 o'clock range, 2 to 3 o'clock range. And it could be as simple as maybe they need to have a light, healthy snack an hour before going to bed. That will help sustain their blood sugar through the night.
Oh, that's a good point. What about, you mentioned in your book the importance of breathing also. I know that many of us feeling this anxiety through treatment, we don't really focus on that much or that often, unless we've actually studied or practicing meditation, but we often forget about the importance of it. Can you address that also?
Well, as you breathe, so we just take a deep breath all together right now. You can just see how it calms down your body in just a matter of seconds. Mm-hmm. And I think the literature shows if you take 5 deep breaths at a 6-second count, 6-second count in, hold it, out, hold it, it's like taking it out. Mm-hmm. And I think we have so much anxiety once again in this world because we're so into doing. And as you take breaths, it also moves your lymphatic system. So in a sense, you're kind of detoxing your lymphatic system, which we all want to do. Mm-hmm. So breath will recenter you back to who you are. It will reconnect you back to your spirit. At the same time, it will provide some detoxification.
That's a great, great idea. Well, thank you, Dr. Robin. I really appreciate it. Again, I highly recommend her book, Wellness on a Shoestring. And thank you so much for talking with us.
Well, thanks for having me.